All right, we are on. All right, Colleen, do you want to take it away?
Yes. Thanks, Jillian. And I'll just start with a warm note of welcome this morning. I know we've got a number of providers who are starting to join us here, and then we will also be recording today's presentation for sharing with our larger pediatrician community. So for those who've carved out some of their lunch hour for us today, thank you for doing so. And we are excited to talk about some resources really to support our pediatricians here in San Mateo County as we gear up for the vaccine being available for more eligible young residents here in the county. Before we dive in, I did want to just do a couple of introductions here today. We're really excited to be joined by some guest speakers this afternoon, including Dr. Chabra, our Medical Director for Family Health Services here with the county, who will be sharing a little bit more about some of kind of what we're seeing at a broad scale. Many folks receive Dr. Chabra's updates and know him through community work, but we are excited to hear a little bit more about what he's seeing coming down the pike for vaccinations for children, and some reflections on some recent data from CMS about how COVID is affecting the pediatric population. We're also joined by a couple of fantastic folks here from our COVID response unit, which you'll be hearing a little bit more about. And that unit is led by Trish Irwin, who is our manager of the San Mateo County CRU, or COVID response unit. And her team has really led vaccination and testing related efforts across the county, including a lot of operational work, strategic planning, and working closely with our community partners here. So she's been someone who has really helped lead the charge on response during this time, and excited to have her here today, as well as two of the recent additions to her team, Dao Chung and Kamini Subramanian, who have joined us today to talk a little bit more about some of the pharmacist support and what that model looks like, something that this team is exploring to really support our pediatric providers in reaching folks for vaccinations. So with that, I have not done nearly enough justice to the fantastic folks that we have joining us today. But Dr. Chabra, if you I wanted to hand it over to you and have you kick us off a little bit with some context on the problem that we're trying to solve and kind of what a little bit more of 2022 looks like in the months ahead.
Thank you so much, Colleen. So I will provide a little bit, just a few slides talking about some of the clinical updates on COVID-19 before handing it over to my colleague, Dr. Trish Irwin. So we can go to the next slide. Here we go. So what we are seeing, here we go. What we're seeing in terms of COVID illness among children is, of course, it's, we've had many cases among children. And fortunately, most of the most severe cases have been in the adult population rather than in the pediatric population. Obviously, a very difficult time for the community and the country and the world. What we're seeing for kids is, of course, we want them to be able to return to school. We want them to be able to participate in activities, and so prevention of COVID will really help with that. From a clinical perspective, we really want to see fewer children hospitalized, particularly hospitalized in the intensive care unit setting. And then, of course, we want to prevent pediatric deaths. What we have seen in the state of California, so this is California data for the entire pandemic. There have been 70 deaths in the pediatric population 0 to 17 in the state of California due to COVID. The median age of these children was 10 years, and 17 out of these 70 were in fact among infants. There was a slightly higher predominance of males over females among these pediatric deaths. And when we look at race ethnicity, what we see, which is true with the broader population as well, is that the African American or Black population and the Pacific Islander population are definitely overrepresented among the pediatric deaths relative to their percentage in the California population. We've seen similar things with the Hispanic population, though it doesn't show up so much in the pediatric age group. And generally, we see the white and some of the Asian populations being underrepresented in the worst outcomes of pediatric disease. I do want to give credit to colleagues at the California Department of Public Health for these slides, Dr. Erica Pan, who's the state epidemiologist for California. And let's go to the next slide. When we look specifically at the deaths among 12 to 17-year-olds in California through the entire pandemic, so the table on the left, we see that there were 14 deaths with 9 out of the 14 young people being unvaccinated. 5 had some level of vaccination, 4 complete vaccination, and 1 had at least 1 dose. Again, looking at the entire pandemic for California, about 70% of these kids had at least one underlying condition: chronic lung disease, asthma, obesity, congenital disease, other neurodevelopmental conditions, that kind of thing. So, certainly a greater risk of this worst outcome among those who have some underlying condition. Let's go to the next slide. Now, this is a slightly different data set. These are data for the entire nation. This came out in a CDC published MMWR article. And this is looking specifically at the 0 to 4-year-old age group. So the age group that fairly soon will likely have a vaccine available to them. And what they found in this, and I'm giving credit to Dr. Sawyer at UCSD for this slide, in the Omicron period, we saw a peak of hospitalizations in early January. And different from the California data for the entire pandemic, when we looked at the Omicron surge, almost 2/3 of the kids had no underlying condition. And then of these who were hospitalized, again, almost a half were under 6 months of age, really highlighting the importance of vaccinating their older siblings and, of course, the adults caring for them or surrounding them, whether it be, parents, other guardians, childcare workers, etc. Of these children hospitalized, again, 0 to 4-year-old, throughout the country during the Omicron surge, 85% were hospitalized because of their COVID. It wasn't an incidental positive test when they were being hospitalized or something else. So it was due to their COVID 85% of the time. And what they found with these Omicron-related hospitalizations, fortunately, were a little shorter, and the need for ICU care was a little less than for Delta-related hospitalizations. So definitely some differences when you compare the recent Omicron surge to the entire pandemic and the various surges we've had over time. Next slide. And now I just want to share a little bit of information about what we're seeing in terms of the vaccines coming down the road over the next few months. So with Pfizer, we know they are requesting full licensure of their vaccine for the adolescents 12 to 15 years of age. That hasn't happened yet. Pfizer is approved full approval is for 16 and older for the Pfizer vaccine. Now, because we don't have full approval for the 12 to 15-year-olds, there is no school mandate for COVID vaccination in California for the 22 through 23 school year for high schoolers, but we'll probably see that in the 23 to 24 school year. Another thing that's coming down the road is emergency use authorization for a third dose, so a booster dose of Pfizer for the 5 to 11-year-olds. And they actually just submitted their data to the FDA on Tuesday. So this is in the works right now at the FDA. And In a second, I'll get to another slide that just shows a little bit of data that they are sharing with the FDA about that group. And then, of course, the third thing we're expecting from Pfizer is an emergency use authorization for children under 5 years of age. So this would be 6 months through 4-year-olds, because the 5 and up are already approved for EUA. The timeline we're hearing is probably June at this point. That's the most recent data we've been hearing through various sources. And so this would be a 6-month through 4-year-old vaccine for Pfizer. They are planning to submit data on a 3-dose series because, as we all heard, the 2 doses may not have produced a strong enough antigenic response. Now for Moderna, right now, the only approvals are full approval of Moderna for 18 and older through the FDA. But they are planning to submit, and actually just submitted today, for EUA approval for the 6-month through 5-year-old age group. So Pfizer's 6-month through 4-year-olds, Moderna's 6-month through 5-year-olds. They've also planning to submit or have submitted for the older children up to 17 years of age. And so we will likely be actually hearing from the FDA around a number of different vaccines for children, both Moderna and Pfizer, probably in the June timeframe. At least that's what we're hearing right now. Of course, these things always change, and so one never quite knows what will happen. And then finally, though this is not a pediatric vaccine, there is a new vaccine for adults, Novavax, which is a protein subunit vaccine, so it's not an mRNA vaccine. So particularly for adults who may be hesitant to take an mRNA vaccine, it would provide another option besides Janssen, which has had its challenges and is being phased out. So Novavax has submitted their EUA to the FDA for approval for an adult vaccine, and we haven't heard from the FDA on that yet. And then finally, we can go to my last slide. So this is just a little more data about the booster dose or 3rd dose submission for 5 to 11-year-olds by Pfizer. Again, this EUA request just went in on Tuesday of this week, so we may hear about this in the month of May, depending how quickly FDA works on that. But some of the data they've shared from their phase 2 and phase 3 trials includes an analysis of 140 kids who received a booster dose about 6 months after their 2nd dose. And so they had a 6-fold increase in neutralizing antibodies against the wild type, the original version of the COVID bug. And with a subset of 30 kids out of those 140, they actually found an even higher 36-fold increase in neutralizing antibodies against the Omicron variant of COVID. So at least in the test, lab setting, there seems to be a strong boosting potential with this 3rd dose, 10 microgram dose for healthy children ages 5 to 11 years of age who received 2 doses of Pfizer already. And they didn't identify any additional safety issues beyond, the ones we all know about with mRNA vaccines. So that's all I wanted to share. Thank you for your attention to this, and hopefully that provides a little bit of context as we hear from the COVID response unit next. Thank you so much.
Great. Thank you, Julian. If you could go to the next slides, thank you. So good afternoon, everybody. My name is Tricia Irwin. I am the manager for the COVID-19 response unit within San Mateo County Health. This is a relatively new unit that we created several months ago to provide kind of ongoing oversight and support for our COVID-19 vaccination and testing. My background, just briefly, is I've been with the county about almost 15 years. The last 2, I've been deeply into COVID, have run all the Mass Vax event centers, San Francisco International Airport sites, as well as our mobile clinics, the pediatric clinics we had at the event center, as well as out in the community. So I've had pretty much been with the vaccine operations since they started in December of 2020. So excited to be overseeing this new unit. Our mission in the unit really is to be looking at kind of where we are now in terms of COVID-19 vaccinations and with our testing, using strategic planning and data analysis. So at this point, we're really looking into sort of who's still missing, maybe even a primary dose or first or second dose. What kind of gaps are we seeing, sort of equity-based gaps, and trying to fill those, and really, like I said, really diving into the data to try to figure out where we need to be. And so operationally, we oversee the 2 vendors that we currently run in the county. We have about 12 ongoing clinics that we run every week. And we also do pop-ups and do various kind of events around from there. We also do the homebound. We're taking over the homebound in terms of folks who can't get out of their homes to deliver vaccines to the home, whether it's first booster, second booster, and congregate settings as well. We either are going to be delivering those services ourselves, or we'll be pulling in a pharmacy or another vendor to kind of go out and do those congregate settings. So again, we have broad sort of oversight of the various vaccination efforts that are going on in the county at this time. And then in addition, working closely with our community partners to make sure that what we're hearing from the community in terms of what barriers there might be or where we should be placed if we're not in a good location, trying to enhance the sort of rates for the 5 to 11-year-olds, different things like that. So it's sort of a dynamic group where everything sort of feeds into operations, whether it's the data analysis or it's the community outreach and education, and then impacts the operations and how we're doing that work. So next slide, please. So on my in my operational team, I have a clinical team, which is 2 pharmacists, which is Dow and Kamini, who are here today and will be speaking to you soon. Both are UCSF trained, and I hired both of them in the fall to when we remobilized the event center for the mass vaccination of the booster clinics. And then when the 5 to 11-year-old vaccine came out, they also were able to provide support and actually lead the pharmacies, the clinics that were out in the field and the pediatric clinics. So they both come with sort of a wealth of training and information and an on-the-ground support for how to do these clinics. So the pharmacists at both MassVax and for our mobile clinics oversee all aspects of vaccine management. So it's the, how do we get it to the site, the actual pulling of the vaccine at the site, the delivery, any medical questions that may come up, et cetera. I've also have Dow County overseeing all of our redistribution efforts as well. So everything that comes into the county that's COVID-19 vaccine, if you're receiving it, they are the ones that are helping to manage that and to get it out to you into the field and stuff like that. So they're very deeply embedded and deeply knowledgeable about the COVID-19 vaccine, about all the vaccine management, delivery, handling, et cetera. And then just in addition, as we talk about, we did do a survey if there was any opportunity to kind of provide on-the-ground support. We also have administrative staff that can support technical issues around the MyTurn platform, which is what the state uses for COVID vaccine clinics and stuff. So that's just another kind of little bit that may or may not come into play for this purposes. So can we go to the next slide? I'm gonna turn it over to Dow and Kamini at this point, but just sort of what we're kind of talking broadly is sort of 3 levels of support that we can provide to you. Sort of just a basic sort of technical assistance, what that might look like, some deeper sort of TA and vaccine support that could be site visits, could be trainings, could be additional kind of on the ground, more in-depth work with your teams or you and your teams, and then also on-site COVID-19 vaccine clinics. So I'll let Dow and Kamini take the lead from here, and I'll step back.
All right, great. So hi, everyone. My name is Dow, one of the pharmacists, as Trish mentioned, on the COVID response unit. Next slide, please. So we have essentially 3 tiers. The first tier would be offering technical assistance. We have a program specialist on our COVID response unit who would be available to help assist to navigate care for MyTurn. And this can be anything between from patient registration, troubleshooting that if your staff is having issues with that, to just simply helping you entering lot numbers for your vaccine inventory. Next slide, please. And so tier 2 is where I'd like to spend a little bit more time on, but tier 2 can be technical assistance and vaccine support. So Kamini and I have had extensive experience managing vaccine. And so a part of the type of support that we can offer is one, storage and handling. As Dr. Traba mentioned, there's going to be a couple more vaccines coming down the pipeline. And so this vaccine management can get even more complex. And so we can provide assistance with that. And then number 2, in the case of any temperature excursions, your COVID vaccines were exposed to temperatures outside of the recommended 2 to 8 degrees Celsius, we can contact the manufacturers on your behalf and provide guidance on next steps. And number 3, in terms of COVID-19 clinical guidelines, it may depend on the site itself, but we can also be available either phone, email, or on-site if you need any support with COVID-19 guidance and also screening eligibility criteria. And so that sort of summarizes our tier 1 and tier 2, and I'll pass it along to Kamini, who will talk a little bit more about tier 3 and what that looks like.
Next slide, please. Well, hi, everyone. My name is Kamini. I'm a pharmacist with the COVID-19 response unit. For tier 3 level support, the COVID response unit will bring a team to vaccinate your patients. We have done this in the past at school locations where we set up a pop-up clinic. We bring all the necessary equipment, vaccine, and staff for the clinic. We provide nurses that are trained to screen the patient, vaccinate, and also provide documentation of the vaccination received. We are able to respond to any concerns and questions that patients may have regarding the COVID vaccine and vaccination. At the end of the clinic, we can provide an end-of-day report that outlines how many vaccinations were provided and the breakdown of pediatric patients and adult patients that were vaccinated with their respective vaccine brand. We are excited to collaborate with all of you and provide any level of assistance required.
Great, thank you both. Yeah, so the kind of the notion here is that we'd be sort of a, if you were interested, sort of a push-in support, so that we would come in, we would run the clinic, it would be all under Dr. Traba's license, San Mateo County Health. So we would sort of be top to bottom, obviously share those records with you, open it up to just your patients, or if you wanted it broader, we could open it up broader in that area of the community. But we could do whatever we wanted, and we would offer all levels of vaccines. So 6 months to 4 years old, to up to the 4-year-old, 5 to 11 boosters potentially, 12 plus boosters, and then adult doses. So we would have the full complement of vaccines, and we would have enough vaccinator. We would, make sure that we have enough vaccinators there to kind of address the different populations, et cetera. And we can do it really as small as needed, or as maybe not as large as needed, but we can do it definitely as small as needed if it's like a half a day or coming in on a weekend when your clinic maybe isn't open, and that might be a better time, or coming in on an evening. Sometimes that's better for the parents and for the families anyways. So, just really thinking about it, we are, very flexible in terms of how we can support you. And again, as Dow and Kamini said, that could also just be coming and do a site visit, helping you to look at kind of what your equipment is, how you're storing your vaccine, how you're managing it, training for staff, and just any kind of technical assistance, or just, I have a question, this happened, somebody got, the vaccine was expired, what should I do about it, et cetera. So they're both very extremely knowledgeable at all this stuff, amongst the most knowledgeable out there, I'd say, when it comes to COVID-19 vaccine management. So we would be really thrilled to be able to offer additional support to you in whatever form that looks like. Colleen and Julian, I think that's it for us. So we'll turn it back over to you.
Thank you so much. Was making sure I'm off mute. All right, I am Julian Aldana. I'm with the Provider Services team at HPSM, and I'm here to talk to you about some of the resources we have on our website that are available to you. If whether you want to sign up to become a vaccinator, or whether you need to resources for tackling vaccine hesitancy, we have pretty much everything that you might need. So if you go to the address that's on the webpage or on the slideshow right now, you'll have a website that has a bunch of resources divided into 4 categories. The categories are enrollment resources, which are to help providers sign up to become registered vaccinators. We have financial resources that, kind of bullet out funding opportunities to support providers in becoming vaccinators, or resources with information about vaccination billing and that kind of thing. We also have another category on vaccine confidence resources, which are really like handouts or printables for your office for members to help build vaccine confidence. We also have a final category for clinical protocols and safety. So these resources were recommended by HPSM providers that were kind of, resources that I think some of our providers wish that they had when they first started administering vaccines. So there's a lot of really great resources there. We'll also make these slides available so that you have these addresses and these resources if you wanted to check them out. So we wanted to open it up now for a Q&A. We have a few prompts here for folks if they're still thinking. So I'll read them out. Do you have any questions about any of the resources we've just shared? What are the barriers to vaccination that you're facing today? What's your level of interest in the support options that were shared? So feel free to either put your questions into the chat, the discussion box, or you can either raise your hand or just shout them out, however you prefer. I actually have one, and that is how would a provider get in contact with you all if they wanted to, either get resources for the CRU in their facility?
That's a great question. You can provide myself, Dow, and Kamini's email addresses to the whole group, and we can respond back to them. We did do a survey out to many of you. You might have responded already, and we do have some maybes and some yeses on those, and we will proactively reach out to you if you've already responded that you're maybe interested or you're definitely interested. And so we will follow up on that survey already for the folks that we have on it.
Great, thank you.
That's great. Thanks, Trish. Also, just to follow up on these, folks may see a little pop-up come up on your screen with a quick poll. So if you are interested in learning more about any of those levels of support that the CRU just walked through, please do go ahead and click on those. We'd love to kind of get a feel for the room on level of interest in either technical assistance plus that storage and handling and vaccination support, or that push-in model that Trish just walked through. Great, and I'll see some responses there coming in. But to echo Julian's questions, curious if folks have any questions, whether that's about any of the statistics that Dr. Chopra shared and kind of the current state of what we're seeing, or more detailed questions about the CRU support. Well, we may have a little bit of a quiet group this afternoon. If anyone's speaking, you may be on mute, or if you have all of your questions answered and this covered it, that is great as well. We do have, again, we'll be recording this, or we have recorded today's discussion, and we'll be sharing that with more of our pediatric community. If you have colleagues who were not able to attend today and you want to take this back and think about it a little bit, we will be following up with some individual pediatrics offices to really just get some more feedback on level of support. And so wanted to thank you for being part of discussion. Julian, I think you had a couple of next steps for us before we close out this afternoon.
Yeah, happy to give folks back more time if there are no other questions. Feel free to reach out with any questions that may come up. We're happy to support you in any way or connect you with the CRU unit. But yeah, or you can direct questions to psinquiries@hpsm.org. But yeah, I think.
Oh, and I think, Julian, I just saw a hand pop up here. Olivia, if you're still on, I think I have had your hand up there with a question. And if you are speaking, I think you're also on mute. So there may be a little button on your top right that looks like a microphone. And the mysteries of Teams, it doesn't always work, but hopefully you can click on that button and unmute yourself to speak. We may be having a little bit of a Teams issue with the microphone there. So Olivia, we can follow up with you after today's meeting for your question. I'm not able to hear you, but if you're able to pop it into the chat or to send a note to any of the speakers on the invitation list today, we'll be sure to follow up there.
I see that Olivia wrote her question in the chat. So she asked, how far is it between the last dose and the third dose, or the booster dose for the 5 to 11-year-olds? So the data they shared with the FDA from what is publicly available was 6 months after. Of course, there are boosters available in other populations after 5 months. And so we don't know the final word on that, but I'm guessing it would be somewhere in the 4 to 6 month range, just based on what we've heard with other boosters. And we know that there is some waning of immunity, after 4 to 6 months after the initial series. So that would be a guess, but we'll have to hear more from the FDA and the CDC advisory committee.
And sorry, I see another hand up, but I wanted to ask another question of Dr. Tarver when we get a minute.
Oh, and I see there's a second part to Olivia's question too. Between the 3 doses for the 6 month, and how much between each dose? So with the 5 to 11-year-olds, it's the usual 3 weeks between the first and second dose, and then again somewhere I think in the 4 to 6 month range for the booster dose, the third dose.
What about the 6 month to 4 years old? Are they talking about the 3-shot interval on that one, Anand? And is there a different spacing for those?
Yeah, that is a good question, and I don't recall what the spacing for those was. I think it was 3 weeks between the first and second dose, but I'm not sure about the third dose. Do you remember, Kamini or Dow? Oh, have you heard? I can't remember what I've read about that. Okay. Yeah.
Dow.
Yeah, so I think based on the information that we have is that it would stick to that same schedule, but we haven't been able to confirm that quite yet. So I think once the data comes out, we'll be able to provide that information to all of our providers.
Yeah. And then I see Dr. Marcella says, what's the interval between COVID and regular vaccines? Yeah, so right now, the interim clinical considerations from the CDC says there is no interval needed between COVID and regular vaccines. So you can do them at the same time or whatever interval you choose, but there is no, required spacing between them. So that is great in terms of obviously pediatric practice, so that if you have a kid coming in for their regular vaccines, you can give them COVID vaccine at that time, or vice versa. If they're coming in for a COVID vaccine and they're behind on their regular vaccines, you can do it at the same time.
Great.
All right. Anyone else have any questions?
Well, thank you to folks for the questions this afternoon. Just to kind of wrap us up, again, a thank you to folks for joining us for today's discussion. If you have more of those questions, please do direct them our way. There's an email address that Julian's sharing here on the screen, that psinquiries@hpsm.org. You can also reach out to anybody who is on the invitation list for today's meeting, and we'll make sure your question gets to the right place. So really a big thank you to Dr. Chabra, to Dr. Irwin, and to our pharmacists for joining us, Kamini and Dow, both today. Appreciate all the work that you're doing to help reach the pediatric population as we prepare for the year ahead. So thank you again for joining us, folks. Do reach out with questions or suggestions or more resources that would be helpful to you. And thank you for everything you're doing to protect our community. Take care.
Thank you.
Thank you.
Thank you.